Okay, just want to make sure that you are able to see the slides that are
Yep.
popping up. Yes, okay.
Yeah.
All right. See, I think people are still slowly trickling in. Just make sure everyone is. And yes. All right. So good afternoon, everyone, and welcome to today's webinar. Manitoba Start is the leading provider of career services to newcomers in the province of Manitoba and connects businesses to a world-class workforce. I would like to welcome you all to the Spotlight webinar, which is a series of live broadcasted events designed to assist you in entering the Manitoba labor market. Manitoba Star acknowledges that we are gathered on a Treaty 1 territory, the traditional lands of the Anishinaabe, Anishinaabe, Dakota Oyate, Denisuline, and Nehethawuk nations, and the homeland of the Red River Métis. We acknowledge that our water is sourced from Shoal Lake 40 First Nation. As a newcomer serving organization, we commit to learning about the histories, cultures, and the rights of the Indigenous communities to strive to build a respectful and supportive relationship for all. So today's webinar is focusing on healthcare retention and recruitment. My name is Medina, and I will be your moderator for today's session. So we'll go over briefly over a few housekeeping items. As you may have noticed, your microphones and cameras are turned off. When we get to the question and answer portion of the webinar, you can use the function to raise your hand feature to indicate that you have a question or a comment. So to do this, you can click on the participants button in the meeting controls, find the raise hand icon next to your name, and click on it. This will notify us that you have raised your hand. The Teams webinars also provide Q&A feature that allows you to ask questions specifically in the Q&A panel. Again, to access this, you can click on the More Options, the 3 dots button in the meeting controls, and select Q&A. You can then type your questions in the Q&A panel. Yes, so that will be all from me. Now I will pass it on over to our presenters today, and we'll go into the webinar.
Thank you so much, Medina. I'm just going to work on sharing my screen here. Okay, does that look all right? You guys can see that? Yes? Okay,
Yes.
perfect. Yep. Awesome, thank you. Okay, so hello everyone. Thank you so much for that very warm welcome, Medina, and thank you all for having us today. We hope that we can give you some useful information after our session. So, as Medina mentioned, my name is Pauline. I am a senior recruiter with the Healthcare Retention and Recruitment Office. So our office supports healthcare professionals such as yourselves that are starting the process of finding a role within our system. We also support internationally trained professionals from outside of Canada, as well as support campus recruitment efforts across the province. I'm joined here by 2 of my colleagues, Paula Healy and Sonia Sharp, and you will hear from these 2 a little bit later on in my presentation. Thank you both for joining me today. So just want to talk a little bit about how our province is laid out in general. So healthcare roles are available throughout all of Manitoba in a wide variety of specialty areas and work locations. Health services in Manitoba are delivered by 5 regional health authorities, a provincial health authority, as well as a provincial cancer authority. So some reasons why you want to maybe work for Manitoba. So in addition to a wide range of competitive salaries, healthcare professionals receive excellent incentives and benefits. Healthcare professionals are eligible to enroll in a comprehensive healthcare plan, and this plan includes things like health and dental coverage, vision, life insurance, long-term disability, and a generous healthcare spending account. Healthcare professionals are also provided with paid vacation, paid sick time, and an employer-matched pension. I do want to mention that physicians do have a little bit of a different compensation package, but the majority of other healthcare professionals, such as nurses and diagnostic professionals, and everyone under the sun under that, are eligible for these ones. So choosing to work within a provincial health system position offers you more stability, benefits, and growth opportunities with a stronger team support and consistent patient care, making it a more reliable long-term career choice. On the screen here are just some of the advantages to choosing to work in one of our regions here in Manitoba. I'll give you just a quick second to read those. I'd like to introduce my colleague Paula Healy to talk about internationally educated physicians.
Hi, everyone. Sorry, I'm just pulling my notes over here. My name is Paula Healy, and I am one of the physician recruiters with the HCRRO. I'm happy to share with you today pathways to registration in Manitoba. So to practice in Manitoba, physicians must obtain registration with the College of Physicians and Surgeons of Manitoba, also known as CPSM. CPSM is the governing body responsible for assessing applications and granting registration to practice. Most internationally trained physicians will require an assessment. The assessment options available in Manitoba are offered through the International Medical Graduate Program at the University of Manitoba, Max Rady College of Medicine. There are two options for family physicians. One is a PRA, which is a practice-ready assessment. And this program is a 3-month assessment that has 3 intakes per year. Physicians must have a minimum of 3 years of independent clinical practice as a general practitioner that must have occurred within 5 years preceding the application deadline. Another option is the MLP-IMG, which is the Manitoba Licensure Program for International Medical Graduates. This program is a 1-year training program that has 1 intake per year. Physicians must be a Canadian citizen or permanent resident, and physicians must have at least 1 year of independent practice as a general practitioner. Another option is PRA for specialist. And although there is an assessment for specialists, specialists cannot apply directly to the IMG program. Specialists must apply for vacancies that are posted on the Make It in Manitoba website. Once the vacancy has closed, a screening panel will select candidates to be interviewed. And if the successful candidate requires an assessment, the department will contact the IMG program to arrange the assessment. To apply to these programs, Medical Council of Canada exams are required. So that would be either the NAC-OSCE or the Medical Council of Canada QE2. More details of these programs can be found on the IMG program website. There's another option to practice in Manitoba, which is as a clinical assistant. Clinical assistants are physician extenders who work with a supervising physician to provide patient care. Working as a clinical assistant will provide internationally trained physicians with hands-on experience in the Canadian healthcare system. Some physicians may work as a clinical assistant while applying to IMG programs. Registration requirements for clinical assistants is located on the CPSM website. Clinical assistant vacancies are posted on the Make It in Manitoba website. This concludes my little bit of presentation, but I also wanted to mention that you may have already been in contact with my colleague Darlene Gray. So please continue contacting her with any questions you may have with regards to pathways to practice in Manitoba. Thank you.
Wonderful. Thank you so much, Paula, for that. Okay, and up next is my colleague Sonia Sharp to talk about internationally educated nurses.
Thank you, Pauline. Hello, everyone. My name is Sonia Sharp. I'm an employment navigator with the Healthcare Retention and Recruitment Office. In my role, I support internationally educated nurses through the nursing registration pathway, trying to find the best fit based upon your nursing background and your career goals. In Manitoba, there are 3 regulated nursing professions: licensed practical nurses, registered nurses, and registered psychiatric nurses. To work as a nurse here, you must be registered with one of the appropriate regulatory bodies: CLPNM for the LPN pathway, CRNM for the RN pathway, and CRPNM for the registered psychiatric nurses pathway. Each regulator is responsible for assessing applications and granting registration to practice. For internationally educated nurses, an assessment and potentially some additional training may be required before you can obtain registration with the Regulatory Nursing College in Manitoba. This can include an assessment of credentials, completion of additional training, and writing the required registration exam. Generally, most IENs can expect to follow a similar process, which typically starts with a credential assessment, either through NNAS or a course-by-course assessment through one of the educational credential assessors. From there, you apply to the appropriate regulatory college, and then you will complete a competency assessment if required. Additionally, it's important to note that the colleges do require that internationally educated nurses meet the English language requirements. From there, you complete any bridging or gap training that you may be required to complete, and the final test is, or the final step is the nursing registration exam before applying for full registration. As there are many steps involved, the government has created the Manitoba Internationally Educated Nurses Program. This initiative provides financial and navigational support to eligible internationally educated nurses pursuing registration in Manitoba. The support can include funding for eligible expenses and one-on-one guidance through the licensure process. To apply to the program and determine if you're eligible for funding, I welcome you to complete the form at the website that is indicated on the slide. And that concludes my piece. I do look forward to meeting any of you internationally educated nurses looking at pursuing your nursing designation here in Manitoba.
Wonderful. Thank you so much, Sonia. So I'm going to talk a little bit about internationally educated diagnostic professionals. So here on the screen are 3 different organizations that you would connect with depending on your profession. So the first is CMART. So these are for internationally educated medical imaging technologists, and they must undergo an assessment through the CMART, or the Canadian Association of Medical Radiation Technologists. They will determine language proficiency and substantial similarity of qualifications and work experience before being able to write the CMART certification exam. So internationally educated MRTs who wish to practice in Manitoba must also apply to the CMART for assessment of their credentials. So once you are registered with CMART, you are definitely eligible for roles in things like X-ray and MRI, mammography, things like that. The next one is the CMLTM. So these are for internationally educated medical laboratory techs that want to practice in Manitoba. You must obtain a certificate with the college to practice, as well as register with the College of Medical Laboratory Technologists of Manitoba. So obtain your certificate. International lab techs need to write the Canadian Alliance of Medical Laboratory Professions entry to practice examination. And lastly, for Sonography Canada, this organization supports sonography professionals through national credentials and entry to practice credentialing exams. A Sonography Canada credential indicates that sonographers have met national requirements for the profession. Internationally educated applicants must submit an alternate pathway application form to initiate the process. This will be assessed according to Sonography Canada's eligibility policy. Once approved, candidates may proceed with the credentialing process, which includes knowledge-based examinations and a Canadian clinical skills assessment. So if you fall under any of these 3 categories, once you are registered with them, we would take you into consideration and be able to provide you with contacts to our diagnostic regional representatives. I do want to mention that all 3 of these have really great websites and have a pathway for international applicants on their websites to review with easy to understand steps. So now I just want to talk about if you're actually ready to apply and you're looking to review what kind of jobs we have on our websites. So we know that navigating the application process is really an important step, and it's helpful to know that each of our regional health authorities have their own unique process. So on this slide, you'll find links to the career pages for the different sites. But please note that this process is for roles that are for nursing and allied health. Physician postings are housed separately, and you can find the link to this website under the Physician tab. Even if you're not ready to apply just yet, you can still log on to these sites and create a user profile. This allows you to start uploading your documents and getting familiar with the system. On some of our career pages, you can also set up email notifications that will alert you when positions of interest come up. So there are some terms that either come up in today's presentation or you'll see when you're applying for jobs that I want to take a quick moment to explain. So a conditional letter of offer is a type of formal communication that outlines the term of an offer, but specifies that certain conditions must be met before the offer becomes final and binding. In other words, it's an offer that is contingent upon the fulfillment of specific conditions or requirements, and the offer is not final until the candidate has met these conditions. Some of these conditions may include passing a background check, completing specific courses or exams, or submitting additional documents or proof of qualifications. Seniority. In unionized healthcare environments, seniority plays a critical role in determining job assignments when applying for new positions. So much as holding a casual position may be flexible, you are not accruing seniority. And we do suggest that anyone in a unionized position to apply for positions that are above and beyond casual so that you are accruing seniority as soon as you can so that you can set yourself up for success in the future. A return of service agreement. This is a contractual agreement in which an individual agrees to work for a specific employer for a predetermined period of time in exchange for certain benefits, such as financial support, training, or education. The agreement outlines the terms under which the individual will return the favor by providing their services to the employer for the agreed upon duration. So some other job posting terminology that you may not be familiar with. FTE, or sometimes you'll say EFT, stands for full-time equivalent. This is the standard measure used to quantify the work performed by employees in terms of full-time hours. It helps organizations determine the total number of hours worked, regardless of whether they are full-time or part-time. So for example, a 1.0 or a full-time employee would work 10 shifts in a two-week working period, where someone in a 0.8 position could work 8 days in a 2-week period. Permanent positions are ongoing, long-term employment where you own the job that you are awarded, whereas term or temporary positions have a fixed duration with a set end date. You may also see indefinite terms that do not have a set end date, but they are still considered a term. In terms of benefits, both versions of employment, term or perm, are provided the same level of benefits. And this one's really important, open until filled. If you see this on a posting, this just means that there's no fixed end date and that postings close once the hiring manager identifies a suitable candidate. So if you see this on your posting, make sure you're applying to this as soon as possible so that you do not miss out on an opportunity. So this marks the end of my formal presentation. Thank you all for having us today, and we will open for questions, or if Medina has extra slides, I can stop sharing.
Yeah, so I don't have any slides, but we can
Okay.
open it up to the questions. I know there was one in the chat. They were wondering if they can ask something about the doctor's diplomas. So I'm not sure if you wanted to ask Anastasia, if you want to ask that question.
Okay, so I'm seeing Anastasia's question. Will there be an opportunity to ask additional questions about the path to confirming a doctor's diploma? If not, is it possible to get an email to whom I could write? Anastasia, I think it would be best if you contacted Darlene Gray, and I can put her email in the chat here. So you could email her directly. It's best if we can see your documents and have a look at them instead of, it's easier to answer your question that way.
Okay, so if you remember, if you want to ask a question, you can raise your hand. So if you look at the top bar, there's a hand little icon. You can press that and it will let me know that you have a question to ask. At that point, I will unmute you so you can ask a question. Okay, we have one from Dorothy, so just give me a second. Okay, Dorothy, you can go ahead and unmute and ask a question.
Yeah, my question goes to Ms. Sawyer for the assessment, the financial and navigational support. How do we go about it?
So the best way is to apply directly to the Manitoba IEN program. At that point, we will connect with you for a one-on-one intake call to determine your eligibility to move forward with the financial. And I can put a link to the form that you would apply to in the chat so that everyone has it.
Okay.
Okay, we have Joe Yanti. Just let me find. All right. Okay, Joyanti, you can go ahead. Joyanti, can you hear me? Okay, so for the sake of time, I'll move on to Karen. Karen, you can go ahead, unmute yourself, and then ask a question.
Thank you. I just want to ask for a specialty practice PRA, if I go in the field as a clinical assistant, does that break like the 5-year gap or no?
Sorry, can you repeat that question?
There's a 5-year gap for the PRA for a specialist. So I'm wondering if going in the field as a clinical assistant, that breaks the gap and that makes me eligible again later to apply for the PRA specialist pathway?
There is a possibility of that, but it would be the program that would determine if they will accept that as your recency of practice.
Okay, and my second question is for the return of service. Is that that is the time? It's it will be made up like when the agreement is set, or is always 5 years?
It's always 5 years.
Okay. Okay, thank you.
Okay. Anastasia, I will allow you to unmute yourself and you can ask a question.
Hi. Can you hear me?
Yes.
Yes.
Yeah, thank you. First of all, thank you for organizing this meeting. And my question is, I received my medical degree in Ukraine as a doctor, but I was a radiologist, so I am not general practitioner. And what is the best way for me to become a family doctor in Canada?
Right. Anastasia, I would really suggest you emailing Darlene with your credentials
Okay.
and your CV so we can review it and then we can provide you with the correct pathway.
Yeah, thank you so much. Appreciate it. Yeah, thank you.
You're very welcome.
Okay. We have Merida. Hey, Merida, you can go ahead.
Hello, I was a medical practitioner for almost 17 years in Mexico. So I have been 9 years in Canada. Currently, I'm working as a healthcare aide, but I have been here 9 years without practicing as a doctor. Do I have any chance to get involved in this pathway?
Yeah, so recency of practice is important when you're applying to one of the programs. Have you considered applying for a clinical assistant?
Yeah, will be another chance, a great opportunity. Yes, could be. Yes.
So, and although I'm suggesting clinical assistant, I would also like to point out that there are positions posted online, but they are very competitive. And with every job posting, we receive anywhere from 60 to 80 applications. So you may be applying for clinical assistant roles and not being contacted. And it's possible that you're not being offered an interview for that particular one, but I would suggest to continue applying to these positions. And in your cover letter, maybe highlight the skills that you bring to that particular posting.
I see. Where can I find the posting for the? To be
Clinical
honest, I haven't
assistance?
applied before. Yes, I haven't applied
Yeah.
before.
So they're on the Make It in Manitoba website.
Okay.
I'll put that in here.
Thanks, Pauline.
Thank you.
Okay, so I think Joyanti, who couldn't unmute their mic, wanted to know about funding opportunities for internationally trained medical graduates in Manitoba. So any funding for IMGs that they will be able to get?
Unfortunately, there isn't any funding support for international medical graduates.
All right. We have Mohammed Saber, if you want to unmute your mic.
Yes, I have a question. It's about the clinical assistant requirement. If possible, give me information about the requirements of clinical assistant because and back home I was a doctor and I want to become a clinical assistant and at first, and after that I will start the license process.
Yes, I'm going to put in the chat the link for CPSM, and that's where you'll find the registration requirements for clinical assistants.
It's okay, but other things, requirements like English language, like some exam and something else.
Yeah, it highlights it all on the website. And yes, you do need to write the NACOSCI exam, or you could have completed your license date of the Medical Council of Canada. There's also an assessment that's offered through the University of Manitoba, but it's a costly exam, and I would strongly suggest writing the NAC instead of the assessment, especially if you're thinking about applying to one of the other programs offered through the IMG program. And English language, there's information on the CPSM website as well, the requirements for English language.
Thank you.
You're very welcome. If you have any other further questions, you're welcome to reach out to my colleague.
Okay.
Okay. So we have a question in the chat from Alina, who says, I have a RN or registered nurse license in Alberta. What are the requirements to license in Manitoba?
Hi, Alina. So I am just going to put in the chat the link to CRNM's website. So if you're registered in another RN Canadian jurisdiction and you've passed the entry level exam, the NCLEX, you'd be able to apply for your Manitoba license. So I will put the link in the chat directly to CRNM's Canadian RN application.
Okay. Thank you, Sonia, for that. Aster, you are next to ask a question. I've unmuted you. You can go ahead. Aster, are you able to unmute? Okay, so while they figure that one out, I'll move over to Waibavi. Okay, Waibavi Renuka, if you want to go ahead and ask your question. Yeah.
Yes, thank you so much. First of all, thank you so much for actually providing us all of this information. And my question is for Paula. You told me that there are 70 to 80 applications for the clinical assistant you are receiving, and tailoring your cover letter to the particular skills that are required and also your experience. And I've been trying to do that. Just want to know if you have any tips which would highlight my application more in terms of when applying for the clinical assistant. If you could.
Yeah, I think it's you want to get your make your application seen. When you receive so many applications,
Yes.
you want to make yours stand out. So I think like going through, reading through the job posting and looking at what the skills they're looking for and trying to highlight that in some way that when they're reviewing your application, that it does stand out. And they usually post positions weekly. So I would strongly suggest checking back every week and seeing what new positions are posted and continue posting.
Okay.
Applying, sorry.
Okay. Thank you.
Can I ask now? Yeah, I'm able to unmute myself.
Aster, yes, go ahead.
Yeah, good afternoon, everyone, and thank you for this opportunity. I am international trained medical doctor, and then my plan was to get registered in Canada and work as a medical doctor. But for some reason, I was unable to, my documents were not verified through MCC, but this is a primary step that you're supposed to do, to write the exams either NAC or MCQ. So I'm wondering if there is any other pathways for candidates like me. This is not my fault. It's just because of some countries' problems. So do you think there is any other means for us to enter to the system? Thank you.
Thanks, Aster. Yeah, that's unfortunate, and it is challenging sometimes. It's very hard without seeing your documents to provide some feedback. So right now, all I can think about is maybe the clinical assistant role, but you do have to have written the Medical Council of Canada NAC OSCE exam to qualify for that.
And the bad thing is, without my documents being verified, I will not be able to write the exams. That's a problem also.
Oh, even your medical school wasn't recognized?
My medical school is recognized, but there used to be something they call it alternative pathway, where they used to verify like doctors who came from my country. But this organization or this body is not working, is not helping medical doctors who came from my country at this
Yeah,
moment.
that's so
So
unfortunate.
without verifying my document, I cannot write any of these exams.
Right. Can you
So
email my colleague Darlene and attach, like if you've got some documents, your CV, and
yes, I have
explain the
my documents.
situation?
I did send my degree to WES for evaluation credential. It's already verified, and they gave me medical degree equivalent to Canadian degree. So I have these documents at least.
That would be perfect. If you can forward those so we can review them, that would be great.
So where can I find the email address that you're
Oh,
telling
I
me
put
to
it in the
put?
chat and it was for, do you need me to put it in here again so it's near the bottom?
Yeah, please.
Sure.
Yeah, thank you.
You're welcome.
Okay, thank you. We have Serhi next. Okay, Serhi, you can go ahead and unmute.
Good afternoon, everyone. My name is Sergey. I'm from Ukraine. I'm family physician. Guys, I have a question because I skip beginning of presentation. Could you please break down each step, what I should to do to become a clinical assistant? Because on the website of Manitoba College of Physicians and Surgeons, they have a lot of additional information, but I cannot find just the right information, just step by step, you know. So first of all, for example, I have to do like my credentials diploma through Medical Council of Canada. Then I have to pass English proficiency test. So whatever. Could you please provide this information? And another question, I cannot see the chat because I connected through my mobile phone, probably something wrong with that, and I cannot see the chat. If it's possible, Manitoba Start could provide all that information what you put in the chat just through email for each of our applicants who presented here. Thank you.
So absolutely. So to apply for a physician assistant, you do need to have graduated from an approved medical school. You do have to have a certain amount of training. No, sorry, not training, but you do need to. Sorry, I'm just looking at this in my head. So you need to be from an approved medical school, but you also need to write the Medical Council of Canada exam, and you may need to write an English language proficiency test.
Sure.
You'll have and a job offer. So you could keep looking online at the Make It in Manitoba website and applying for jobs.
Okay, thank you. And one more question. Now I'm currently working as a healthcare aide, and I trying to apply plenty times to position in the hospitals, but it's impossible. I don't know why. I already contacted to some of you guys probably because I emailed one guy from Manitoba healthcare workers or career workers, and I didn't get any response. And maybe you have some tips. So someone already asked about it, and I ask it again how to get a position in the hospital, because you know I get my resume and my CV and I went to HR department, said, guys, this is me, this is my resume, this is my work experience. They said no, just apply through website, and I applied plenty times. I said again, and there is no response. Like a lottery, you know, try again. I tried 2 years, guys. I tried to do it, and no success. Maybe you have some tips or tricks about it. And another question, sorry for interrupting. My medical school, when I was finished it's already under occupation, and that it was territory of Ukraine. It's under Russia now. So would I have some problems with approval? You know?
Yeah, that might be an issue.
Yeah.
We would definitely need to look at that because your medical school, it needs to be approved for sure. And sometimes that does happen. Medical schools have been have been around for, you know, 10 years, 20 years, and then all of a sudden they stop. And if they stop, you no longer meet the requirements. But you did ask about about applying for clinical assistant roles. And it is very challenging. There's only a limited amount of positions. And
Yes, I understand.
yeah, and like I mentioned earlier, we receive many applications for each position. So it's very hard to say what they're looking for. What I strongly suggest is to keep applying. And as you're reviewing the job posting, to make sure you highlight the skill sets that you will bring to that particular position in a way that when they're reviewing applications, those words stand out. Those skills stand out.
Got it. Okay, thank you very much.
You're very welcome.
Yeah, thank you.
Thank you, Serhi. Okay, Elmar, you can go ahead, unmute. Yeah.
Thank you, Merida. Good afternoon, and thank you for the presentation. So I'm Elmar from Care Center for International Educated Nurses, which is funded by IRCC, and it's an agency based out of Toronto, but we also support IENs who are, bound to different provinces, and we have some clients who are bound for Manitoba who might benefit from the IEN Manitoba project. So is there like a direct email address that I can refer clients into, or do we just, direct them to the IEN Manitoba project website?
If they're interested in coming on to the Manitoba IEN program, I would recommend the website. If they just have questions, I will put an email address to our Nurse Employment Navigator inbox, and they can message us there for more questions.
Alrighty, sounds good. Thank you, Sonia.
You're welcome. Thanks, Elmer.
Okay, so I don't see any other raised hands. If you have a question, again, you can raise your hand or type it in the Q&A. There was a question in the Q&A. Is there any possibility of finding a job as a healthcare aide while the nursing validation process is done?
Sonia, did you want to answer that one?
Yeah,
Or?
so I'm looking for I just saw the internationally educated pharmacist. I'm just looking for information about that. Sorry.
I'm pretty sure there's information for healthcare aides on our website. And
Yes.
there's information for certified and uncertified healthcare aides.
Sorry, I was typing. I missed the whole question. My apologies.
No, that's good. I'm going to look up that link because you're right, Paula. There is something on our site for healthcare aides. Yeah. They're under clinical support. So that is in our chat. Someone asked, correct? I don't know where it is, but I'll just pop it to the bottom. So these are
yes.
clinical support. So finding the role, so healthcare aide, uncertified home care attendant. All the information is on that link. And I'm just asking about the pharmacy.
Thank you. Next we have Kwabena. Kwabena, I'll allow you to unmute yourself. You can go ahead. Kwabena Danso, you can unmute your mic and ask your question. Might be having troubles finding that. Mic not unmuting. It should be able to.
Okay, we added a couple links there for pharmacy registration. So there's one through the U of M, as well as through the college directly. Our colleague Dominique, who's also on the call in the background, has added that as well. I'm checking with our colleague who has pharmacy under her portfolio. I'm not sure if there's any like pathways for pharmacists, but as soon as she answers, I'll let you know if we're still on the call here.
Okay.
Okay, so I see Kwabana's
yeah.
question. Thanks for this. Concerning physicians or doctors that is only applied to family physicians or other specialties. Emergency physician. Want to know about pathways to work in Canada and if not. So they're looking at currently creating an assessment process for emergency physicians. It's not completed yet. I'd love to get your contact information. Could I ask you as well to email Darlene Gray so we can forward your information to the people who are looking at that or at organizing that assessment? Perfect.
Okay.
Sure, if you can certainly copy me. I'll put my information here.
Okay, did we miss any questions in the chat? I think I've answered a couple.
Yeah. Yes, the recording of the presentation will be on Manitoba Star website under events, and you can select recorded webinars, and it will give you a list of all the webinars we've had recently.
So there's a chat about screening resumes. It really depends on the hiring manager. I haven't heard of us doing AI-based searches. Our team does not use AI-based. So whenever we get a resume in our team, that's part of our portfolio, we do manually screen every single one of them. I know the physician team does that as well when they get resumes and they go through every single page and make sure that they have all the qualifications that are required. I can't say the same for managers across the region because every single unit, every department has their own hiring team. But if it is a position that's done through the recruitment team, we do it all manually. We do not use AI. Again, this is really tough because we do deal with hiring managers. It can vary. It really depends on the position and what the hiring manager likes to do for their interview process. I've done some nursing positions where they've wanted a top 15 and wanted me to tier them from 1 to 3. It just really depends on their hiring manager style. And we go with whatever they've requested from us.
Okay, and in the Q&A portion, question is a personal support worker and healthcare aide certification the same or not?
So that's a great question. It really depends on where your healthcare or your PSW certificate comes from. Unfortunately, if you have done studies for personal support worker outside of Manitoba, a lot of the schooling is not currently being recognized. You would need to redo some of that schooling here in Manitoba. We are looking to get that changed. But there is I'm going to see if I can find it on our website. There is a listing of all the approved schools that are currently being accepted under healthcare aide positions, because we do have a lot of out of province applicants for healthcare aides. And unfortunately, the same thing we have to tell them is you have to be under one of these programs. And those programs include.
I think Dom just shared the link and
Oh,
it's right at
perfect.
the
Yeah.
bottom of
Yeah,
that.
right at the bottom. So
section.
most of them are in Manitoba. There's Northland College in Saskatchewan, Sask Polytech in Saskatchewan. They're all if they're recognized, they're all within Canada. There's currently no process in place to recognize other educational institutions, but like I said, they are looking to get that changed because there are many reputable colleges and institutions across Canada that are definitely good institutions, but we just don't have that program in place to be able to review the curriculums between the two. Okay. Anything else? Again, that's a really hard question about the standard lead time between initial application and the second round of interviews. It's impossible to tell. We have in undershared health alone, we have over or almost 40,000 employees. So that means there's 40,000 roles, and that could be up to 40,000 vacancies if you want to look at that way. And every single one of those vacancies is assigned to a different hiring manager. So it is impossible to know unless you have a direct contact with that manager and you can ask them. So that's something that we do recommend as recruiters when you are in that interview process. Ask about that timeline. That's a really good question. When they say, hey, do you have any questions for me? We ask you to ask them stuff like that. When can I expect to hear back? Is there a second interview? Is it another panel interview, et cetera, because it's very, very specific to that hiring manager. Paula, maybe can you grab this one? Difference between a physician assistant and a clinical assistant.
For sure. Thanks for your question, Karen. So physician assistants and clinical assistants in the role will actually do the same thing, and you apply to the job postings, many of them will be for physician assistant / clinical assistant. Really, the only difference is physician assistant has a 2-year degree, have gone through the physician assistant training program.
Right, thank you, Paula. So I think we have time for maybe one more question, if anybody wants to pop anything else in there last minute. Advice for RN to go. Is it advised for an RN to go into a healthcare aide position while waiting for the assessment? Sonia, can you?
Yeah, so that would be based upon personal preference. It's always good to get experience in a Canadian setting. So if you have the opportunity and willingness, it could be a good option for you. But again, personal preference.
Yeah, so I just added to the chat again. If you think of any questions after this session, especially about physicians, please send Darlene Gray an email. I understand that she has had some contact with many of you that are involved with Manitoba Start.
And there's one more question. Nursing placement for UK nurses. Sonia, what's the best route for them?
I would say I'm going to put an email in. I'm not 100% sure. So kind of what you're referring to. So I will send you an email in the chat, Rita, and then just email us there.
And the question about if clinical assistants need, where did that go? Certification with BLS, ACLS, it would depend on the position. And they would identify that in the job posting.
terms of the healthcare aid job with the verified international health education, I believe you'd still have to do your HCA certification.
Yeah, for a healthcare aid position, you will require a certificate. There are positions, if you go to that link for uncertified healthcare aid positions, you could potentially be considered for those positions.
So I'm not too sure about your question, Camila. You'd have to, because I'm not overly familiar with that one. So you'd have to connect with me. But for the second question for internationally trained lab tech, sorry, just got to chat. There's no funding for lab techs at this time trying to get their license. Unfortunately, we don't have a pathway for that.
We have a Merida.
Yeah, let's take that one as our
Okay.
last question. And if anybody else wants to ask us, we can do it offline, but let's take that one as our last question of the day.
I have a question.
Yes.
Can you hear me?
Yes.
Okay. So what about if I, as a physician, internationally educated doctor, I would like to study to be a nurse. Is there any like a chance to take some credentials in considerations or some study, or have to study the whole career?
Yeah, if to become a nurse, you would have to have a general nursing education. So the two educations don't overlap for one another.
Thank you.
Okay, well, I think we're at that time. Thank you, Paula, Sonia, Pauline, for having doing this session. It was, I think, very valuable, and we had quite a few participants join us, which is amazing. And thank you for sharing the contact information and ways for our clients to get in touch with you for any further questions. Yeah.
Wonderful. Thank you, everyone, for having us today.
Thank you. It was our pleasure.
Thank you.
Thank
Thank
you.
you so much.